Hello, Kent County. I'm Dr. Adam London, Director of the Kent County Health Department. And today I want to give you a quick summary of our current numbers and then answer a few questions that we've been receiving recently. So we continue to see a slight upward trend in our average numbers of new COVID cases, positivity rate. Right now we're averaging 267 new cases per day over the last week. That's up a little bit from last week. And our positivity rate is at 14.9% of all tests over the past few days have been coming back positive. That's up 1% from last week. So we continue to see this slow but very gradual increase. It feels like we're kind of at a plateau, hopefully, with this current surge in COVID cases. I hope that holds true and goes down pretty soon. We're seeing 1 to 2 deaths per day still here in Kent County, and that's the most grave and concerning thing that we have right now. And we also know that our hospitals are really struggling with capacity in this moment. In fact, some of them have actually delayed and are postponing some elective services and some services of lesser priority. So again, I think people often think of COVID as a COVID problem, but when COVID is at such high numbers in our community, it really stresses our hospitals' ability to care and provide services across a wide array of health issues. So please keep that in mind. It's much bigger than just COVID, and let's do what we can to keep its spread and its transmission as low as possible in the community. So a few questions that I'm hearing quite often. The first is about testing, and how can I find out where to go to get tested? We have a lot of those resources listed on our website, accesskent.com. Follow the link to COVID information, and you'll see a link there for COVID testing locations. There are a number of providers here in the Grand Rapids area and throughout West Michigan that can help set you up with a COVID test pretty quickly. And while you're there, you can also find information to vaccine sites. It's very important for those of you who haven't been vaccinated yet, please do so. For those of you who are eligible for a booster vaccine, please do that. And please remember, this is a great time to get the flu shot also. We expect to see a more severe than usual flu season this year, so please get both things done as soon as you can. We're also getting questions about lost vaccine cards. People would like to get a replacement of a vaccine card that they misplaced. Generally, the best way to do that is to call your provider if you received your vaccine from your doctor's office. If not, you can call us here at the Kent County Health Department at 616-632-7249, or you can email us at medicalrecords@kentcountymi.gov. Again, that's medicalrecords@kentcountymi.gov, or you can also visit us during normal hours at any one of our KCHD sites. Another question that we're starting to hear is about COVID, and will it always be with us? And the answer to that, quite frankly, is yes, probably, because COVID, the SARS-CoV-2 virus rather, it has its reservoir in humans and in a number of other species of animal. And now we're finding it in deer and in many other species. So it's very difficult to eradicate. In fact, it's impossible with current technology to eradicate a virus when it is present in so many species like that. It's just not really possible. What we realize is going to happen is we're going to have what's called an endemic level, which is kind of a lower static level of a virus present, a lower instance of virus present in a community going forward. With each of these waves of new cases, we're seeing that the peak is lower and lower. Eventually, that's going to normalize at a much lower level where we have a static amount of COVID illness present in our community, similar to the cold or other illnesses that are spread on an ongoing basis for a long time to come. What's important there is we recognize we can't always have all of the restrictions in place to manage that. But as the peaks of those surges in cases is lower, we can much more effectively manage COVID through health education, through vaccine, and through smart hygiene and personal choices in much the same way that we keep people safe from other illnesses. People are also asking, when will the order requiring facial mask use for pre-K through 6th graders stop? The way the order is set up is that will expire 60 days after it's made available, after the vaccine is made available to children aged 5 through 11. Right now we know that the FDA is scheduled to review the data later this month, and we expect they'll have a decision and a recommendation about how to use the vaccine in early November. So for all intents and purposes, we're expecting, if we get that approval and that recommendation, we're expecting the order for those pre-K through 6th graders and mask use to expire right around New Year's. So that means, we're going to have holidays, of course, mid-December. When kids go back to school in January, that order should be, if we get that approval, should be expired at that time. So that's all for today. Really, again, I want to thank everyone for all that you're doing to make this a healthier community for everyone, and appreciate that, and hope you have a great day.